absolutely big good news coming out of VA, VHA specifically, for mental health appointments. This is good news all around, and I think everyone's going to agree on this. Like, comment, share, do all the things, subscribe, please, help get the word out. That's what we're trying to do here. What the VA has done with mental health is dating back to June 27th of 2023. If you paid a copay to see a mental health professional at the VA or through VA's network, through community care, and you had to pay a copay for that, the VA is going to do two things. One, they're going to reimburse you for the first 3 visits of every calendar year. So let's say you saw mental health 3 times from June of 2023 for the rest of that year, and you paid copays, the VA is going to automatically reimburse you. You don't have to do anything. From right now, at this moment, veterans have 3 mental health visits without copays, whether you're service connected for mental health or not, or you're 50% or higher, or 40% or lower. It does not matter. The VA is going to spot 3 mental health care visits within VA's network or community care network every single calendar year up until the last day of 2027. All around, this is really good news, especially for veterans who, 1, are 40% or below and not service connected for mental health, and 2, those veterans who just simply aren't service connected for anything. However, they still get their health care through the VA. They will no longer be required to pay that copay up to 3 visits per year. What I'm gonna do is read the VA news article, and I'm gonna have the link down below in the pinned comments, so that way you can see that that article for yourself. But here's what the VA says. It says this co-payment exemption benefits date back to June 27, 2023, and by law will end December 29th of 2027. To be eligible for this exemption, the outpatient visit must be with a qualified mental health professional at VA or provided through VA's network of community care providers. Easy peasy. VA will automatically refund for any copays paid to VA on or after June 27th of 2023 for these appointments, with no further action required by those veterans. So if you get a random check in the mail and you've been having copays for VA healthcare for mental health, that's what it is, okay? Congrats on your reimbursements. VA and the entire Biden-Harris administration are committed to providing all veterans with timely, world-class mental health care they deserve. VA is currently delivering mental health appointments to more veterans while reducing mental health wait times for new appointments. And this is where this article really gets a sour taste in my mouth personally. It says, additionally, veteran trust in VA outpatient care is at 91.8%. I just had a live stream with all the viewers talking about the VA's press conference and looking at those questions and their VA trust scores. I did a video, I'll pin that below in the pinned comments, of this 91.8% all-time high from for VA outpatient care, which is coming from peer-reviewed studies, hospital ratings, and patient satisfaction surveys. You know, 91.8% is such a huge approval rating. No assessment for anything ever, especially the VA, is going to be at 91.8%. That's insane. Okay, that's almost nobody complaining about VHA, VA healthcare, which is simply not the case. And you can just scan any social media platform you want and just look at the amount of negative comments about VHA. Obviously, that pool of veterans was not accounted for in this 91.8%. But let's go ahead and continue reading the article. So we want every veteran, this is from the Secretary of VA, Dennis McDonough, right, our boy. We want every veteran, regardless of their financial status, to have access to mental health care they deserve. And that's what this co-payment exemption is all about. That's good. I think objectively that's a solid statement. We are constantly working to expand access to mental health care, and we won't rest until every veteran has access to care and wherever they need it. On top of the mental health thing, VA is making very, very big strides in mental health, in addition to CHAMP VA for those veterans that are 100% PNT or IU PNT and qualify for CHAMP VA. CHAMP VA just added 3 new additional benefits. I'll go ahead and link that below in the pinned comments as well. But a lot of that revolves around dependent care for mental health. So the VA is definitely on track and on board with the mental health crisis nationwide. I think social media has a lot to do with that. That's my personal opinion. But the VA, the point is the VA is on top of it, okay? They're on top of getting mental health care to the veteran, or as you know, according to VA News. Continue reading. In addition to this copayment exemption, VA launched a new policy in 2023 allowing eligible veterans and certain former service members, which that I don't understand. Eligible veterans and certain former service members. I'm going to assume they mean like those with bad conduct discharges, or, you know, other than honorable, things like that. In acute suicidal crisis to go to any VA or non-VA emergency facility for no cost emergency health care. Since then, more than 60,000 veterans and former service members have used this benefit, providing them with life-saving care and saving millions of dollars in healthcare costs. The policy increased access to no-cost emergent suicide care for up to 9 million individuals. Now, where does this actually come from? It comes from the Cleveland-Dole Act of 2022, and that ends, again, remember, it ends December 29th of 2027. Objectively, I think this is a good thing, okay? Those who are not service connected for mental health and those with a less than 50% rating for VA disability compensation now do not have to pay copays for mental health appointments within VA's network. That's a good thing. My question is, why does it end December of 2027? Why can't this 3 times per calendar year just continue? I mean, what's the thing there? Okay, what is stopping the act of 2022 in 2027? Riddle me that. That's what I don't understand. Right, I'm gonna assume when the time comes, it's a money thing, it's a budget problem. I'm going to assume when the time comes that this would be extended or expanded. I would like to see that, but that's my number one question. It's weird to me that this benefit, which is objectively good, okay, for all veterans, why does it end in 2027? But that's all I got. You know, like, comment, share, subscribe, do all the things. Let me know below what you think about this. 3 mental health care visits per calendar year are now free without copays, right? This is good news, and that's all I got.